Hey. All right, good morning or afternoon, everyone, at least if you're on the East Coast. We're looking forward to our conversation today with our forever bosses, Mia and myself, Congresswoman Robin Kelly, who chairs the Congressional Black Caucus Health Brain Trust, and then Congresswoman Yvette Clarke, who also serves on the Energy and Commerce Committee. The great thing about these two women is that I've had the opportunity to work with them both in the health disparities space. I am wearing my sort of Kelly Classic t-shirt. NMQF had the opportunity to sponsor the Kelly Classic, and we do a basketball tournament. We also do a health fair to talk about health disparities, and then also just make sure that everyone is as educated as they can be going into the new year. And then last year, we did the same with Congresswoman Clarke. So we got the opportunity to go to her hometown of Brooklyn, New York. And so that was great. I just wanted to intro it off this way because Mia and I had the opportunity to work for Miss Kelly for years. And we were able to do there's Miss Kelly, the Kelly Report on Health Disparities. And we just were sort of reviewing it and preparing for today's webinar, just seeing how much she's done and Miss Clarke have done to work to eliminate health disparities. And so really looking forward to this conversation. Mia?
Yeah, Brandon, I just want to follow up and first and foremost say thank you all for joining us and for your patience as we, of course, during COVID, we give each other grace and space with our technical difficulties. And so, if we were gathering together, this would be the time where we'd be talking and catching up. And speaking of talking and catching up, I'm very excited to be talking and catching up with my favorite person and member in Congress, Congresswoman Robin Kelly. She is absolutely always in my heart, no matter how far we go. And as Brandon mentioned, indeed, as Brandon mentioned, we've had the particular pleasure of working for her, and especially with respect to her work on the Congressional Black Caucus Health Brain Trust, and I served as her policy director as well. And so really excited to have her on. We're going to talk about some really important things, and we'll probably have some laughs too. So be ready to laugh, be ready to learn. And once Congresswoman Clarke gets on here, it's going to be a whole nother dimension. I promise you all are in for a pleasant treat. And so as we are, I know Congresswoman Clarke is getting on, but let me just tell you a little bit about Congresswoman Kelly, and then we'll talk about what it is that we're going to talk about today. And when I say a little bit, I'm being facetious, because this woman has, in terms of her career in public service, it just completely spans the gamut, so everywhere from local office through congressional office, Congresswoman Kelly has done it all. She's been the advocate for Illinois families. She's been the advocate with respect to promoting health equity and really closing disparity gaps through policy. And especially you would know her work in the maternal health space. And if nothing else, then certainly in the gun violence space. Congresswoman Kelly has been the lead effort across the Democratic Party and within Congress on that. She's been in Congress since 2013. She came in on special election and has worked otherwise to just expand economic opportunity, community wellness, public safety, everything that essentially makes us well, she has had her hand in. So because we are talking specifically about a working group out of the Energy and Commerce Committee, I do want to make sure that you all know that Congresswoman Kelly is a member of the House Energy and Commerce Committee, which is the main policy writing body of the House. And Congresswoman Clarke is also a member. She's the vice chair. And Congresswoman Kelly specifically serves on ENC and also on the Health, Energy, and Consumer Protection and Commerce subcommittees. So all kinds of mouthfuls there. I am not really going to read her full bio. I want to really also just have her tell you some things about herself, but I must also share that she's the co-chair of the Congressional Gun Violence Prevention Task Force. She's the co-chair on the, and through that effort, that's where she wrote her Kelly Report, the first ever congressional analysis of the nation's gun violence epidemic. She offered that in 2014, if I'm not mistaken. She's also the co-chair of the Congressional Caucus on Black Women and Girls, the chair, as I mentioned, of the Congressional Black Caucus Health Brain Trust. There's nothing that she can't do, and really excited to have her. So Congresswoman Kelly, welcome, welcome, welcome.
Thank you so much. I really am honored to be here, and of course, always honored to see my past employees that have just gone on and left me, but gone on bigger and better things. I'm just so proud of you and so proud of Brandon. So happy to be here with you. And, you know, Representative Clarke is my homegirl. So we work on a lot of things together. And it seems like it's more and more and more and more, but we have so much in common. But I mean, you've kind of talked about a lot of things in a nutshell. I have a background really in counseling and social service and those kind of things, but then got involved in government and have never left, from local government to state to county and now to the federal government. And you hit my passions. I ran on gun violence prevention, and I still need to run on gun violence prevention, because you see across this country, and particularly in Chicago, you know, which really has, not that it ever slowed down, but it's really out there again. Unfortunately, we've had some horrible weekends. And you know how I feel about healthcare, not something I thought I was going to be so much of a champion of in Congress, but that's the way when Marsha Fudge asked me to be the chair of the Health Brain Trust, and I'm so glad she did, because there's so much work that needs to be done. And now I've concentrated so much on just, you know, COVID, and then the racial disparities. We've done a lot of work around it, but a lot of work needs to be done. And I'm even more committed to the issue of ending the racial disparities in healthcare, but they're all over, you know. And I think, you know, I was on the working group to help VP Biden with his healthcare platform, and not to be political, but it's very important to him also. I'll just say that.
Well, why don't you tell us a bit more, Congresswoman Kelly? So you and Congresswoman Clarke, as you mentioned, you've worked together on so many different things, right?
We're the co-founders and continue to be the co-chairs of the Caucus on Black Women and Girls. And initially, you know, of course, they gave me the health, and Congresswoman Clarke had more of the economics. And then Congresswoman Bonnie Watson Coleman, she had the girls, and very concerned about the school and prison pipeline. But we've done so many things. We've held briefings all over this country.
Yeah.
You know, as you know, missing girls and other things have been in Memphis, maternal mortality and infant mortality, because Steve Cohen joined us. In Seattle, we did the cultural homelessness of Black women in technology, and then in Chicago, you know, we've done all kinds of things. And in New York, you know, Congresswoman Clarke had a fantastic one on financial literacy and Black women in the economy. And one of the people she had, you know, I adopted her too, and she's done a lot of financial literacy stuff for us. But then I've worked really closely with Congresswoman Karen Bass and Congresswoman Barbara Lee around the COVID and racial disparities. And then what I call my Healthcare 7, I had other people come and join us, and from E&C in particular, and Yvette Clarke and G.K. Butterfield and Lisa Blunt Rochester, Sheila Jackson Lee, and then Cedric Richmond and the Whip, they were with us also. And we interviewed all kinds of people, Black medical schools, Black doctors from across the country. We met with CDC a number of times, NIH. So out of that, Congresswoman Clarke called me, I think one night, and said, what do you think about heading up a racial disparities working group specifically to energy and commerce? And so she approached as the vice chair, approached the chair, and Chair Pallone gave permission for us to do it. But he threw some extra things on our plate. So now we're not just looking at healthcare, we're looking at communication and technology, we're looking at the environment, which of course has something to do with healthcare, consumer protection. So we're looking at the whole gamut of racial disparities in all of those areas. And we just actually had our first meeting with our other colleagues from E&C who want to be on it the other day. So I mean, really from the meeting, I feel fired up, actually. You know, people are really excited to really get to the bottom of this and to start making improvements that are so terribly needed. And, you know, the other thing is Chicago was with COVID, initially 72% of the people dying were African-American. That's gotten much better, but we still, you know, lead the pack. Now more Latinx are getting the disease, but we're still dying more. And I know that people like to talk about, well, you know, you have diabetes, you have heart disease, you know, you're fatter and that kind of thing. But there's reasons, you know, we have that. So we don't want to talk about, you know, blame the victim. We want to talk about the, you know, social determinants of health, the, you know, wealth gap, the job gap, education. I mean, you name it, housing, the environment. And those are things that the committee will be able to look into and make recommendations. So I'm excited.
Yeah, I feel your excitement. It's palpable for sure. But this is also it's not new for you in terms of the way that you approach your work. And I just want to just reiterate a number of things that you said. You know, a lot of what you do in collaboration with other members of Congress, right? So you have these really deep, authentic relationships, not just within the Congressional Black Caucus, not just within Energy and Commerce, but you work bipartisanly, you work really well bicamerally, you know, and it's so exciting to see, and really also just heartening to see democracy at work through members such as yourself. And speaking of members with whom you've worked over and over again, we are so excited to have Congresswoman Kelly and Congresswoman Yvette Clarke with us today from the 9th District of New York. Welcome to you, Congresswoman Mysora. I'm very excited to see you. How are you?
I'm doing well. So good to see you, Maya, and great to see. And thank you for having me. And Brandon, thank you for convening us today. And to my sister colleague, it's so great to be with you again, Robin Kelly. We're on the phone constantly with one another, so it's like every day we miss each other. So virtual hug, my sister, virtual hug.
Congresswoman Clarke, I just wanted to briefly give the people a bit of background on you, and then I want to turn it over to you to just tell us a little bit about yourself, and then also just a little bit about your take on the working group and how you're working with Congresswoman Kelly and others to really uplift the issue of health inequities and disparities. So you're from you hail from the 9th District of New York, where, you know, this is essentially your homeland. You're from Central Brooklyn, and I've never seen, outside of Congresswoman Kelly, someone rep New York so hard, you know, because she is originally from New York. I'm going to leave you alone, though, Congresswoman Kelly. You are the proud daughter of Jamaican immigrants, and you never let anyone forget that, you know, in terms of your path and your passion for your Caribbean heritage, and the way that you carry that in Congress, it translates in your work as the co-chair for the Congressional Caribbean Caucus, and the way that you foster relationships overall between the U.S. and our Caribbean brothers and sisters in the overall community. You serve as the vice chair of EMC, and also you're a member of the Homeland Security Committee. And especially when we're talking about pandemic, you can't have the conversation about secure homelands without also looping in the conversation around public wellness, right? And so I'm really excited that you can bring that perspective today. I can go on and on and on about what it is that you do, and so I really want the audience to hear from you in terms of your work, not just in the health realm and with the Caribbean community, but also in tech and media, policy, and everything else that you touch on. So if you can just tell us a bit more about yourself.
Absolutely. First of all, let me thank you once again, and let me just say that, you know, we're living in really interesting times. Epic times that none of us could have ever foreshadowed. And I think that being in New York, which was really hard hit by the pandemic, the original epicenter of the COVID-19 outbreak, has brought sort of a renewed lens to communities of color, Black communities in particular. And it's almost a confluence of dynamics, because as a member of the Congressional Black Caucus, as a member of the House of Representatives, our role has always been to uplift sort of the challenges, the concerns, the disparities, and the inequities that we see across the board when it comes to legislating, when it comes to addressing policy. And we're sort of been, pushing a rock up a mountain when it came to sort of an acceptance and understanding of how this impacted the quality of life for people of African descent. And I say that in the context of how things are prioritized in terms of policy, what comes to the fore in terms of markups in committees, in terms of conversations in the greater Democratic Conference and the Democratic Caucus. And, unfortunately, what COVID-19 has done, it has laid bare what so many of us have been fighting for, have been talking about, have been trying to build common cause around, have been trying to make a priority for this nation. And it's unfortunate that it has come at such a great cost in human life and livelihoods, but we're here to seize that moment. And having done all of the work in advance, which is why your organization is in the sweet spot right now, it positions us to really stand up the infrastructure of leadership that we'd always been building to move things forward. And part of that was my thinking that in a committee like the Energy and Commerce Committee, and being the first Black woman to serve as vice chair of that committee, it was an opportune moment, particularly in light of my observations of what took place with respect to how COVID-19 attacked Black bodies, to demand of our chairman a task force or working group that would focus on that. And I knew that since my sister, Congresswoman Akeley, is a new member of the committee, coming with her depth and breadth of understanding of this work as being our leader for the Congressional Black Caucuses, the brain trust on healthcare for Black communities, that we had, a eureka moment where we could really advance the work that Akeley had been doing ever since she embraced that leadership. And she has embraced that leadership with such gusto, with such thoroughness, with such expertise, that this was our moment. And so I approached her and said, Robin, we got to do this. Let's push up on Frank Pallone. And I pushed up on Frank Pallone, and I said, Frank Pallone, this is your moment. We can build a legacy here in the Energy and Commerce Committee, particularly with respect to what we've all witnessed. I mean, it was alarming to most people what we already knew about vulnerabilities in our communities, the health disparities that existed, the lack of public health infrastructure that's required to really meet the needs of Black communities. And he relented. It took some convincing, but not only did he relent on the area of healthcare, he went a step further and asked Congresswoman Kelly and I to lead Racial Disparity Working Group across the entire jurisdiction of Energy and Commerce, which then brings in the areas of environmental justice in the environment, energy, consumer protection, telecommunications, you name it, we pretty much have oversight for it because of the vast jurisdiction of our committee. And I think that this is historic, and we have to maximize and capitalize off of this moment that we're in, because, people unfortunately believe sometimes that our issues are boutique or trendy. And we know what happens with trends. They come in and they come out. this is the moment, I believe, for us to maximize and to build sustainable relationships and sustainable policy prescriptions that will move us past this point of COVID-19 into a post-COVID existence with the tools, the laws, and the expertise needed to make sure that this next generation, which will be the post-COVID generation, will have the healthcare, the access to information, access to opportunities that are required in a multiracial, multi-generational, multi-religious civil society. And so I'm excited about this work. Again, I'm pained at the fact that it took this type of occurrence for us to really get to this point. However, let us maximize on it. So thank you so much for having me as part of this discussion today, and I look forward to answering your question.
Yeah, well, I mean, you said it, and I want to just loop in what both of you were saying, you know, because you were both essentially saying that this moment is so very critical to how we move forward, not just in terms of our present existence, but to your point, Congresswoman Clarke, for those who are coming up right now, right? And so I read something not long ago that says this generation is Generation C, right, as in Generation COVID. And it's, I don't know if that's actually going to be the terminology that's used, but for me, it's interesting in terms of really helping us to prioritize where we're going with respect to policy, right? And so I want to bring us in. I want to bring this moment into context by comparing it to a moment 57 years ago, right? So we're coming up on the 57th anniversary of the March on Washington, right? And the March on Washington is right down the street from where you all work, or excuse me, the site of the march, right, is right down the street from where you all work. And it's not lost upon me that just like this moment, there were a cataclysm of events that brought about that march, and that march eventually brought about premier legislation, civil rights legislation. And with respect to health, it brought about essentially Medicare and Medicaid. It led right into the 1965 adoption of Medicare and Medicaid, right? So how is it that we can, in a similar vein, think about this moment of COVID-19, this moment of pandemic, and this moment of intersectional issues that threaten our public health, and the role of policymakers leveraging what you all are talking about with respect to authentic relationship building, coalition building, leaning hard on our leaders, right? Not just amongst yourselves, but those who are in the public space. So how should we think about this moment, and how does it compare to where we have been, more specifically in 1963, and where we're going and what we're commemorating in the next couple of months? And both of you, Congresswoman Kelly, why don't you go ahead?
Of course, the Congresswoman and I were mere children. I don't even know if Yvette was born, you know, but
I wasn't born, so.
Brag. I think that what I've noticed, even with people I'm close to that are not Black, and I think with our colleagues, I'll just say that there is more of a understanding or appreciation for Black Lives Matter, you know, and that how deep the issue really is, and how, you know, we've been treated so badly, or we rank so low in so many things, in everything, just about. And I think there's more of an appreciation, and I think that's why, like the working group, that people volunteered to be a part, and the working group is diverse and from all over the country. They want to be a part of the working group, and also now more and more, you know, just like Black members don't just have Black constituents. In fact, we have many Black members that the majority of their constituents are white, but that's the same thing, you know, with some of our white members, that they have a very diverse population. But I'm seeing more caring, more commitment, more sensitivity. And as we say, we have to take care of this moment so it becomes a movement that is not just a moment. I did an op-ed on, yes, you know, Aunt Jemima, changing that's nice, and Uncle Ben, and giving your staff Juneteenth off is nice. But a year from now, where are we going to be? You know, are we going to see improvements in, you know, health? And if you want to talk about COVID, because it's going to be with us a while, the way things are going, is there going to be more testing? Is there going to be treatment? Is there going to be more contact tracing, more people to do that? Like, how can we really take advantage of this moment and improve the lives of people of color, you know, and all people? But because I know, like, my area is urban, suburban, and rural, and I have 4 people in rural areas that are white that are really suffering too. But, you know, there's a lot of things we need to do, not just one thing. And I think that the House is off. You know, we have a recovery bill that really deals with infrastructure, you know, and it's not just roads and bridges, it's broadband and the internet. COVID has pointed out a lot of things, improve infrastructure in our hospitals and our healthcare. And so there's different things like that. And if we could ever get our bills passed in the Senate, you know, I think that we would see maybe not a whole new way of doing things, but an excellent start in changing how people are treated, the health care they get, physical and mental health. We talk about physical a lot, but and mental health also, a lot of things, childcare, just a lot of things that go into improving the quality of life for people.
And Soramia, you know, I am a beneficiary of that civil rights movement. As Congresswoman Kelly mentioned, I was really a twinkle in my parents' eyes when all the work that brought that day and that legislation to fruition. So I was a beneficiary of that. And I've always sort of felt the impact of what was done in the wake of the civil rights movement, because in New York, it enabled girls that look like me to grow up in an environment where they were centered in policy, in education, in healthcare. I mean, you know, I tell people just anecdotally, when I was in public school in New York, you had access to healthcare in public school. You had access to financial literacy in public school. These were all demands that were created by those movements, whether it was the Black Power movement or the Civil Rights movement, that made it possible for a cohort of young people, children in those days, to get a centered education that centered them and their humanity and everything that was done in New York during those days. But Jim Crow, you know, he knows how to morph. And even those who claim sort of a wider lens to the challenges of people of African descent and minorities, as long as they can continue to benefit from the status quo, they begin to sort of lose their enthusiasm around what's trendy. And so that's why I spoke about the need to bake in sustainable relationships. You know, what I think encourages me in this moment is the intergenerational nature of what is taking place. Because, you know, as folks grow older and you know, a pecking order is established in society, people forget the history of what took place that got us to the point where we legislated certain types of things, whether it's fair housing, whether it's Medicaid, Medicare, whether it's, you know, voting rights. And you would think that there would be a vested interest in all Americans in preserving those rights and making them something that we have as a collective lived experience. But again, like I said, when you have to make a choice between, you know, whether I'm advantaged versus someone else, and you feed into the narratives that are oftentimes repeated and over again in press, in stereotypes, in media, then whether you want to admit it or not, that implicit bias creeps in, and that becomes a justification for why those people don't deserve this, that, or the other, and why budget priorities, whether it's at the federal, state, or municipal level, have to be shifted into a containment strategy or a, we can do better for you than you can for yourself mentality. And that's what we're up against. And I'm very conscious of that as someone who saw the pendulum swing during my lifetime. And as a result of that, I think that the work that Congresswoman Kelly and I do is going to be very, very important, that our allies and our advocates are walking lockstep with us, and that there's an education process so that we're not living in episodes, but we understand that we're part of an epic. And that epic has at the center of it justice, fairness, and equity. And if we can ingrain that in everything that we do, then the next generation will inherit from us that consciousness that will then be passed on to their children and their children, and it becomes generational. So it's really breaking a mindset that was allowed to sort of mushroom over time since that 50-year mark that you spoke about to today. Because there's no reason we should be screaming Black Lives Matter when there's still footage of the Edmund Pettus Bridge, right? But the reality is so many benefited from that status quo that we became more and more marginal, that we were too demanding. I remember the statement that would be played out there when we would even raise the issue of inequity. Oh, you guys playing the black card. Remember that? You're playing the race card. And my response was always, you're damn right I'm playing the race. I am the race card. So, this is a reality. And so you're absolutely right. This is a historic moment. We have to capture it, but we also have to shift. There has to be a transformation, and that's a mentality issue.
It's a mentality issue, and the other, I want to pick up a number of things that you said, and then also bring it back to some things I heard Congresswoman Kelly say earlier. So you're talking about legacy building, right? You're talking about, as you mentioned, education, not just within peer groups and amongst your co-leaders in Congress, but for the next generation, right? So, for instance, with you, Congresswoman Clarke, you succeeded your mother's position in city council when you were in New York, right? And I imagine for you, that was very much because of how you were really coming to terms with the political process and how you were potentially moved by what you were seeing within Brooklyn, in your community, right? And really wanting to be a part of that. And what I see now is a number of people, people within my generation, millennials, is it Gen Z? Wasn't it?
Yes, Gen Z.
Gen Z, and
Gen Z plus.
Exactly. A number of people who are younger and older are asking questions a lot differently. And it's I imagine a result of them seeing people who are in power and being empowered, right? Similar to how you likely were with your mother, or they're seeing people who are in power who are out of touch and who are unwilling to ask and engage questions, right? Or those who don't necessarily understand, to Congresswoman Kelly's earlier point, that intersection between health and wellness and those socially determined factors, those structural root causes with respect to poor health, right? So it's not just what happens within a clinical setting. It's also when you leave the clinical setting, are you going home to a safe environment? Do you have access to nutritious and affordable housing and food and all of that, right? So with all that said, right, we're starting in a place, we're not starting anew, right? Because we've inherited issues, but we've also inherited some really creative strategies, right, and innovations. And we're building on and improving on models. but we're still dealing with the issue of racism is still with us, genderism is still with us, ableism is still with us, COVID-19 isn't going anywhere, it's going to still be with us. So where do we start? Where does the working group start with that amongst all of its members, dealing with all these issues inside clinical spaces, outside of clinical spaces, and dealing with people who may not necessarily want to innovate on the design and may want to do the same thing? Where do we start?
Well, go ahead, Robin.
No, like I said, we just had our first meeting, and what I have all my notes in front of me, but what we talked about is where are we? What's the baseline of where we are, and then where do we want to go? And there, so we're taking all of these topics, and we're going to go back to people more expert than us in the different areas and talk about what's the baseline, where we are. And then also we have all the chairs of the subcommittees on the working group. So they're going to start having hearings around this issue in their, environmental justice, specific, intentional, I'll put it like that, around these topics, to bring witnesses in, just to make sure everybody's educated, everybody hears, what the issues are. But ultimately, what we'd like to do, if there's legislation that's needed, if there's resources that are needed, if there's new programs that are needed, that's what we want to work towards, to really make, changes that can be seen and felt. But we're trying to see really where we are, like, and establishing what the baseline is.
And just to follow up with Congresswoman Kelly, we also recognize that a lot of that information is resident in organizations within our communities. And so advocacy is going to be a very important part of this, because the last thing we need are folks to be in a silo and not embracing the recommendations or the baseline. The idea is to come to consensus and then have a movement that is undergirding the work that is being done. Because we've seen people undermine any suggestion that we can do this in a culturally competent way. Our expertise, our experts, our academicians are oftentimes given short shrift when they've been studying and doing this work for generations, and they're never given the platform to introduce those ideas, their research and their information. And we think that it's critical that that rises to the level of a working group like the one that we have. Because you know what happens to Southern Black rural folks may not manifest itself the same way as some folks in the industrial Midwest or some folks who are in the inner city. We need to have that full spectrum of understanding, so that our work is nuanced enough to capture the overwhelming spaces in which we reside and we find ourselves. We don't know what the impact of the USDA's policies are on a rural farmer, and how that has made it impossible for them to have access to broadband or access to healthcare and the development of clinics that they've been requesting for generations now. So these are the types of things that we think we can uncover with our working group. And the more that we lay bare in this moment where everything is being exposed, I think the more energy is fed into the movement, and the more our advocacy organizations can become institutionalized. Because the other part of it is how our institutions are constantly being broken down or discredited in order to meet the agendas of others who don't want to address our issues. Anytime we want to address our issues, I find that there's a crowd out there that in their brains is saying, oh, these people want reparations. Yes, we do. Because it all goes back to why we are in the state that we're in at this point. It's the systemic, institutional racism that has relegated us to the least desirable living circumstances, the lowest wage employment, the least access to health care. And this has gone on from the very origins of our existence in this nation.
Yeah, and the point that you're making, oh yes, go ahead, Congresswoman.
One other thing that we're going to hold ourselves accountable, because whatever we find, we're going to hold our different agencies, the federal government,
That's right.
Who are you hiring? Who are you promoting? Who are your contracts with, outside of government, so we're going to hold ourselves accountable and do better oversight in that arena also.
Well, to your point about structural and systemic racism, accountability is anti-racism, right? That is the anecdote, essentially, right? Accountability, structural competency, leadership that's representative, putting your money where your mouth is. So budget priorities really mapping and aligning with equity policy, right? And across the fields that you've mentioned, the broadband, clinical settings that are accessible, all of that, right? So one thing that you both mentioned and alluded to, so Congresswoman Clarke, you represent a largely urban district. Congresswoman Kelly, your district is urban, suburban, and rural. I heard you say that for years and years and years. It is always in my head, right? So talk to me about, and both of you come from states that have expanded Medicaid, right? And in a lot of ways have been leading the charge with respect to COVID-19 and really taking a handle around this pandemic. But what about those who are in southern states, right? Or they're in states where Medicaid has not been expanded? What role does your work around strengthening our current health, guiding health principle and policy, the ACA, what role does that play in the working group's work to not just meet the moment of COVID, but to really perpetuate the movement of health equity, even across states and jurisdictions that haven't expanded Medicaid?
You want me to go first?
It's like double dutch. You get it where you fit in.
The thing is, I think we're doing more and more, like with the maternal mortality bill that you know a lot about, that passed out of ENC. We couldn't get exactly what we wanted passed out, but we did get something passed out where the states actually incentivized in that instance to expand, Medicaid for a year off of the postpartum period. Now, again, like I said before, I don't want to get, too political. I want to be respectful of everybody's views, but if things are different after November, I think we'll see a difference. I was one of the people that helped shape Vice President Biden's healthcare platform. There were 4 of us from his camp and 4 from Senator Sanders' camp, and we got along and did a lot of hard work. And I think you'll see in that, like, what he wants to do complements, what the House already wants to do with lowering prescription drugs and maternal mortality improvement, just the different things that, ENC, has been a leader, has worked on. I do think that there could be brighter days ahead and more of a meeting of a meshing of what needs to be done. And if we can change a few things despite those states not expanding, there's other things that we can do that will get healthcare to people, looking at enhancing the ACA and in fact, we just passed the bill in the House, but also, beside enhancing it, but also public option and things like that. So I do feel like there's better things coming with the goal in the end of healthcare for everybody.
And I think that we're in a transformative moment. You keep hearing the terminology across, across the nation, and particularly in the media of reimagining. And, I think that clearly, surviving and living through a pandemic has revealed the need for all Americans to have quality health care. And how that manifests itself will be really based on the people. Right now, I don't see how people can be aloof when you have, the spread of a deadly virus spiking, in their midst. And they saw their leadership mislead them, right? Whether it's some governors in some of these southern states that opened up their economies far too early, and now they're experiencing record numbers of deaths of loved ones. These are all going to be shaping the expectations of leadership going forward. When you've lived through a period of time where you've been deceived by leadership, I think that it's only human nature to want to dispense with that. There may be some, we're not monolithic, but I think with us providing an alternative, a viable alternative in terms of access to healthcare, as long as we harp on that, because there's nothing else, and everyone recognizes it now. Without your health, there's no economy, there's no quality of life, there's nothing. And we can maximize on that, exploit it, if you will, over and over and over again, because it's a shared experience with a nation and, quite frankly, a globe. And so I think that personally, I'm for Medicare for all, and we're not there yet. But, if we introduce a public option, I think that that is going to take on a new life. If we don't, and we look at how we expand access to Medicaid in those areas of the country where it doesn't exist, the issue with COVID-19 is it travels, right? It travels. So no one is safe, no matter where you live. As long as there's one person with COVID-19, everyone is vulnerable. I remind the people in my district, because, we're going through a slower process in New York because of the density in which we live, that this thing started with one person in Hunan, China, and we lost over 30,000 people in New York State. So we have to continue to hammer that home. And why it's important is, if we want to reimagine ourselves as a prosperous nation, then we have to have a healthcare infrastructure that supports that.
And ladies, I excuse myself. I have Zoom I have to get to. So thank you so much, and let us come back and update folks on where we are. And it's tough because we're Zooming so much and we don't really see each other, but we would love to come back, and I'm going to leave you in good hands with my sister colleague. So thank you so much.
Congresswoman. I'll be seeing you soon. I'm gonna call you. Okay. Congresswoman Clarke, I'm wondering if you can, so you said, you've given us so many jewels today, right? So I just, and you jump in if I've missed anything. So you've talked to us about, essentially about legacy, right? And the legacy of the problems that have preceded us, and the ways that leaders have stepped up to really see to those issues in the moment, but ensure that the innovations they put forward are not just trendy, that they're not just for the moment, but that it's a movement. You talked to us today about reimagination and how we are having to hold ourselves accountable in terms of our own internal biases, because we all have them, but making sure that we address them so that they don't become structural issues, and instead addressing those structural issues so that future generations are able to inherit a sense of accountability and overall valuing of everyone's lives, right, in the same way, but especially those who historically have been undervalued, right, and undermined. You've talked to us about what it means to work with others across within your committee, across the aisle, and really coming to having a plan, I want you to please leave us, no pressure, but leave us with, your words. We have people on the call who are very versed and know the political process quite well. They work as lobbyists, they're activists, they're advocates. There are others who are on the call who might be new to the political process. What can you give all of us, and graciously so, because we're so grateful that you're here with us, that we need to walk away from this webinar understanding in terms of what we can each do in this structural movement toward equity?
So I'm gonna just share a little bit about my background, because you mentioned this in some of your commentary. I learned and gained my passion for service because of the organizing that my mother was engaged in when I was a child. During those days, she couldn't afford childcare, so I was that kid in the adult meeting with the lunchbox and the crayons in the corner. And as a result of that, just watching how people organize and knowing what they were organizing was for my benefit, it shaped my genetic code in such a way that my passion for service to my people was hyper enhanced. In the same way today, we need to be able to continue the organizing that we're doing, using the momentum of this moment to heal ourselves in demanding that our policies and our policy makers are reflective of our collective desire, so that, the moment that the economy opens up again, people don't go back to business as usual, but understand that we have to all recalibrate the way that we demand that this democracy work for us. And I think that we see the origins of that. There will be those who will want to exploit it, and there will be those who will want to disrupt it. So to the extent that we're building unity of mission, unity and common cause of rebuilding and reimagining what it is that we see our civil society requires of us in this time and in the future, we have to be willing to sacrifice in order to maintain it. That sacrifice from my mom meant that she left banking, but she probably would be the president of a bank at a financial institution if she had maintained that, right? To education. She changed her career, right? For others, it meant during the civil rights movement, they didn't graduate college. They had those dreams and aspirations, but the mission meant a certain level of personal sacrifice. The question we have to ask ourselves in this moment is, what are we willing to sacrifice? Because with the reorganizing, the reimagining, the reconstructing, the deconstructing of systemic racism, institutional racism, requires that we can't sit in the comfort of our homes, we can't sit with our feet up, we can't accept the rhetoric as though it feels good, as good intentions when it comes to the actions, right? We have to demand it, we have to maintain it, we have to undergird those who are moving it. And that movement requires all of us to participate. So I wanted to share that because I am the product of a movement, not a moment. And there was a gap. There was a gap where we coasted off of that movement. And I say all the time, baby boomers happen to be one of the most selfish generations out there because we lived off of the work of the people that came before us, right? Well, to a certain extent, we were successful with the civil rights, voting rights movement, but we didn't continue to build the momentum coming out of that. we were happy, with that moment, and we gave trust to those who, participated, but we didn't recognize the change in climate, because the moment Richard Nixon was elected, the people should have known that, things that we put in place were in jeopardy, right? We have to continue to make these demands of our elected representatives and hold them accountable for it. I'm looking forward to the work that we have to do, closing out this session of the Congress and moving into the 117th session. And reminding my kid, I will play the race card each and every day, if need be, to make sure that that public health infrastructure that we need in this nation is stood up, it's robust, and that we are creating a pipeline of healthcare professionals that are culturally competent, coming out of our lived experiences in order to continue to build that. That's critical in addressing what we know is at the core of how we will come out of this COVID crisis, and beyond that, how we will prosper as a nation.
Just on a personal level, I want to thank you, Congresswoman Clarke, my soror, for just continuously bringing the wisdom, for living your truth, and for really walking in your conviction with respect to the power of policy. And then, I couldn't help but to feel a quickening, when you were just talking, and just always as you present. I even felt a little teary-eyed, because I do feel that conviction, where we're moving the needle forward, where the power of policy is really going to change people's lives and essentially redistribute power in a really very meaningful way. So on behalf of everyone in the audience, thank you so much. And thank you to Congresswoman Kelly for joining us today. And again, NMQF, thank you for hosting this really very powerful conversation. As Congresswoman Kelly said, let's please have these two women back. And just a reminder, we're here every Friday. I'm Mia Keys. I'm with the American Medical Association Center for Health Equity. And I'm very excited to continuously partner with NMQF on these. And I'll turn it over to you, Brandon. And
Thank you all. Thank you.
Congresswoman. Thanks, Mia, as always. Thanks, Congresswoman Kelly. Really appreciate it. I know that this committee is in its pretty nascent stages, but we have ideas out there, but we want to continue to accept ideas. So I'm going to take it on the onus of myself as someone that works for NMQF to hear your ideas. So if you're on the call and you have an idea that you want to share with the Congresswoman about their committee as something they should really work on and look to, I'll collect those and get them to their staff, so that's something that they can know that you guys care about. So
and Brendan, we are looking forward to partnering with you. As I've stated, this endeavor will require the expertise of advocacy professionals, academicians, in order for us to really build sound and enduring policy. And you all have what it takes. You have all the connections. So we look forward to working with you going forward. And likewise, Mia, we are looking forward as well to working with you and all of your connections. This is when, the constellations have lined up in a very special way, and we need to maximize and capitalize off of that.
All right.
Hold us to it. Hold us to it,
Congresswoman. All right. Well, nothing else needs to be said. So besides, have a great weekend.
Yeah. Thank you all.
Bye.
Bye.